my name's Jennifer. I'm one of the physician assistants here at Pennsylvania Pain and Spine. I'm here speaking today to let you know all of the various procedures and injections we offer here at Pennsylvania Pain and Spine. Now, don't let our name fool you. We not only work on the spine, but we work on various other parts of the body as well. Starting with the spine, we obviously do epidurals of the neck and the back to treat issues such as stenosis, disc issues, radiculopathy, or pinched nerves. We do facet injections and ablations to the neck and back as well, which can help the arthritis of the vertebral joints and things like compression fractures of the vertebral bodies. We also provide a procedure called vertebroplasty, which can also help the compression fractures of the spine. We also provide injections called intercostal nerve blocks. Those blocks can treat conditions such as fractured ribs. Can also treat shingles in the trunk region. So if you have pain there, those nerve injections might be able to help. We do Botox injections for chronic migraines and spasmodic torticollis. We can do sphenopalatine ganglion blocks, which also treat chronic migraines and other conditions such as trigeminal neuralgia and atypical facial pain. We do stellate ganglion blocks, which treat certain types of head, shoulder, and arm pain. We also do major joint injections of the shoulders, the hips, the knees, but we also do injections of many other smaller joints, such as in the hands, wrists, and feet and ankles. Many injections that we use steroids in the joint to help decrease inflammation, but in some joints we also use a substance that we call viscosupplementation, which is more of like a gel or a lubricant to help lubricate the joints. That we usually use in the knees, but can be used in other joints such as the hips and the shoulders. We also treat chronic conditions such as chronic tendonitis or small tears, such as in a rotator cuff in the shoulder. We can use procedures called prolotherapy or platelet-rich plasma, PRP, to help treat minor injuries or tears such as rotator cuff tears. The prolotherapy is actually an injection of dextrose, which helps stimulate inflammation to help promote healing. PRP, or platelet-rich plasma, is a procedure where we draw a small vial of your blood, we spin it down in a centrifuge and extract the platelets, and then we re-inject your own platelets into whichever body part is injured or needs repair. Both of those procedures, the prolotherapy and the platelet-rich plasma, again, help stimulate inflammation to promote healing of those injured tissues or areas. We can also perform a lumbar sympathetic nerve block for conditions such as chronic regional pain syndrome. We have femoral obturator nerve blocks to treat persistent hip pain despite hip replacements. We also, if you have a knee replacement and are still having persistent pain in the knee, we can try a genicular nerve block to help treat that. We do celiac plexus nerve blocks for chronic abdominal pain from issues with pancreas or other abdominal organs, or persistent abdominal pain from cancer or prior surgeries. We can do a pudendal nerve block or a ganglion impar block for conditions that cause chronic pain around the tailbone or the genital areas. We can do trigger point injections and motor nerve blocks for tight muscle spasms or trigger points to various areas. Other slightly more invasive procedures, but still minimally invasive procedures we can do are procedures called mild or vertiflex. Those procedures can treat neurogenic claudication from spinal stenosis. We can do corner lock for chronic issues with the SI joint. We also perform subcutaneous stimulation for chronic pain, as well as intrathecal pump implants for chronic pain issues. Those procedures are done in our outpatient surgical center because they do require some light sedation, as you would get for like a colonoscopy. So the procedures I have just briefly talked about are some of the most common procedures that we do. Of course, there are many other types of injections and procedures that our doctors perform as well. Unfortunately, not all of our procedures are covered by insurance, but many can be paid for out of pocket if desired. Please feel free to discuss your pain issues or any of these various injections or procedures with any of our providers so that we may determine which procedure might be best for you. Again, my name is Jen. I'm one of the physician assistants here at Pennsylvania Pain and Spine, and I look forward to treating you.